Welcome to the instructional video for Guimard's S2100 Surgical Chloe. Surgical Chloe incorporates many of the standard features that customers have come to expect from the Guimard family that allow students to train in a real environment using real instruments. What makes this product unique is the incorporation of new material technologies that allow reproduction of lifelike abdominal inserts and uterine assemblies that can be cut and sutured like real tissue using real surgical instruments. In this video, we will show Chloe's capabilities, including demonstrations of a handful of surgical procedures. We will cover how to put together and operate the simulator and its peripherals, and how to set up the system for different scenarios, not only on the simulator, but on the Guimard UI control software as well.
Hello, I'm Marty Olson, an OB/GYN physician, residency program director, and one of the inventors of Surgical Chloe. Today I'm going to spend some time describing the features of Surgical Chloe, which is a new modality to enhance patient safety and teach medical learners. Surgical Chloe bleeds when she's cut. She's an operating room teacher, but she also has a chance to assess the entire surgical team. The vision of Surgical Chloe is twofold. First, you can just teach people how to operate. But second, if you want to assess the entire team function of your unit, you can have Surgical Chloe arrive in the emergency room. She can be assessed. A diagnosis can be made. She can then be transported to the operating room. At that point, she has a surgical procedure. She could have a complication such as malignant hyperthermia in the operating room. And then she goes to the recovery room or the post-operative floor, where she could have another complication such as a pulmonary embolus. And throughout this time, Surgical Chloe is observed, she's assessed, the team is assessed, the surgical talent is assessed, and no patient is ever placed at risk. Systems-based practice can be taught as a part of any scenario in which the learners have to assess data outside their own knowledge base in order to solve the clinical problem. Professionalism can be addressed in scenarios such as the fire in the operating room scenario, where the learners must take control of a dangerous situation and protect their patient. Patient care and medical knowledge are commonly demonstrated in almost any scenario which is run. Surgical Chloe can be used to teach laparotomy, laparoscopy, or vaginal surgical skills. So let's take a look at the world's first full-body, high-fidelity surgical simulator. The gynecologic procedures on Surgical Chloe will be performed on interchangeable uterine assemblies. Here's an example of the normal uterus, called uterine assembly number 1. The normal uterus has an ectopic pregnancy. It has a normal sized uterus. It also has a blood supply into the uterine cavity so that a vaginal hemorrhage can be documented in a scenario such as the von Willebrand's disease scenario. So the vision of this particular uterine assembly is that the learners could first do a vaginal hemorrhage scenario, then they could do an ectopic pregnancy scenario, and then they could do a hysterectomy scenario. And if they wanted to, they could injure the bladder and then they could repair the bladder. You'll notice that this assembly has a blood supply here and here, as well as here and here. So this simulates the normal uterine blood supply in a fashion such that the learners can ligate a vessel, they can tie a knot on the vessel, and if their knot is not secure, it will continue to bleed. Uterine assembly number 2 includes an enlarged uterus. You notice this is bigger than uterine assembly number 1. It has a larger cavity inside. So uterine assembly number 2 can have products of conception placed up inside its cavity so that the learners can perform a suction curettage of the uterus. This uterine assembly also has an ectopic pregnancy. You'll notice also it has an immature teratoma, also called a dermoid. So this immature teratoma can be removed just like a real immature teratoma. If the learners cut into it, it'll make a gooey mess just like happens in an operating room with a real patient. So the vision of this particular assembly is that first the learners can do a suction curettage of the uterus. Then the learners can do an ectopic pregnancy. Then the learners can remove the dermoid. Then the learners can do a hysterectomy. Maybe it's going to be an abdominal hysterectomy. Maybe it's going to be a vaginal hysterectomy with morcellation. In this fashion, at least 4 uses from this one uterine assembly should occur. Uterine assembly number 3 is the fibroid uterus. If you'll take a look, you'll notice a fibroid here. Now this is an example of an assembly in which one would need to maximize the planning purposes in order to use the assembly as many times as possible. Obviously you can't do your hysterectomy first if you wanted to teach your residents how to do a myomectomy. So you do your myomectomy first, then you might do some of the other procedures that are available. This assembly has a normal functioning cyst, so you could do some procedure on a normal cyst. This assembly also has an endometrioma, so you could have your residents, medical students, or other learners resect an endometrioma. Finally, after you've done your 3 procedures, then here again you could do a hysterectomy, such as a vaginal hysterectomy with morcellation or an abdominal hysterectomy. This part is called the abdominal wall. This is the laparotomy abdominal wall. Within the laparotomy abdominal wall is the abdominal insert, which is the part that's actually going to be cut during a laparotomy. Let's take a look at the abdominal insert. It's got simulated skin, which is thick enough for you to reclose and reuse, just like the rest of this part. The subcutaneous tissue has blood embedded in it. So this fake blood looks very real. When the learners make their incision and they see the blood at the end of their scalpel blade, that helps them suspend their disbelief. It helps them act like they would act in a real operating room. Under the subcutaneous tissue, of course, is the fascia. This fascia is designed so that a realistic fan and steel incision can be made. Of course, you've got rectus bellies. They're separated just like rectus bellies in a real surgical case. And underneath that's the peritoneum, which of course has to be carefully entered so that any intraperitoneal contents are not injured. This part is the laparoscopy abdominal wall. You'll notice the pre-drilled ports. Now, of course, if you wanted to teach your learners how to do trocar insertion, you'd go back to this other abdominal wall and you'd use your abdominal insert to insert the trocars. But if your education for that day is confined to something such as, say, let's resect an ectopic pregnancy, the pre-drilled ports are here. You could insert your trocars through the pre-drilled ports and go through that educational session.
Chloe has manual blinking eyes so they can remain open while patient history is being taken and closed during anesthesia, regardless as to whether she is sitting up or lying down. Users can perform chin lift and jaw thrust. Chloe's realistic airway can be intubated both nasally and orally using endotracheal tubes or LMA. Perform ventilations with a bag valve mask or mechanical ventilator. Ventilations and chest compressions are measured and logged by the Guimard Ui software. The on-screen CPR monitor provides the instructor with real-time feedback on the student's performance. Chloe comes with streaming audio, allowing the instructor to simulate the patient's voice and listen to the caregiver's conversation wirelessly at distances up to 50 meters. Streaming audio is useful when taking patient history. The actor portraying the patient can provide misleading information, making diagnosis more difficult, such as in a real situation. In addition to the streaming audio, Chloe comes with a library of pre-recorded responses.
I have bad cramps in my abdomen. It burns when I pee. I think I'm pregnant. My stomach hurts.
Providers can easily control rate and depth of respiration and observe chest rise. Choose upper airway sounds and independent left and right lung sounds, which are synchronized with selectable breathing patterns. sounds can be auscultated anteriorly. Multiple sounds are available. Chloe accommodates assisted ventilation, including BVM and mechanical support. Chloe has several realistic heart sounds which are tied to a user-defined heart rate and selectable rhythms. Chloe is equipped with 4 conductive sites to allow the use of a real ECG monitor. This feature permits the user to track cardiac rhythms and events with their own equipment, just like with a human patient. The instructor can select from the extensive built-in library of cardiac rhythms. Bilateral carotid, brachial, and radial pulses are palpable and operate continuously synchronized with the ECG. Pulse strength is blood pressure dependent. Programmable blood pressure can be read using a real sphygmomanometer, and providers can auscultate the Korotkov sounds. Chloe also features a pulse oximetry sensor within the forefinger of the left hand. This allows providers to attach commercially available pulse oximetry devices. Chloe's left arm can be used to practice IV procedures. Note: to simulate a patient with no accessible peripheral IV sites, connect only the syringe. Pull the plunger to create suction, which will collapse the veins. Disconnect the syringe tube from the arm port while maintaining suction. The port will seal, and the veins will remain collapsed. Chloe also has IM sites on both of her deltoids and quadriceps. The surgical Chloe package includes an all-in-one touchscreen PC preloaded with the Guimard monitor software. The patient monitor system provides the additional vital signs information that may not be detectable on the simulator using real medical equipment. Interactive Guimard monitor software is fully customizable, capable of displaying up to 12 dynamic waveforms and up to 12 numeric parameters. In addition, care providers can receive and view images such as ultrasounds, CT scans, and lab results directly on the monitor screen. The Guimard Ui Interface is a powerful and easy-to-use simulator control and student evaluation software. Guimard Ui has two operating modes, each designed to accommodate basic and advanced users. In the manual mode, all vital signs are changed by the instructor or programmed into automated scenarios. In the automatic mode, the powerful physiologic engine can assist the instructor by automatically changing related vital signs parameters. Guimard Ui includes a large library of pre-programmed simulation scenarios, medications, and speech responses. The Guimard Ui interface, control elements, and scenario programming procedures are consistent throughout the Guimard family of high-fidelity simulators. Once familiarized, the skills are learned and easily applied when operating any of the other simulators within the Guimard family. For easy navigation, controls and functions are divided into tabs. During simulation, change the vital signs on the fly using the Details tab. Alternatively, program automated linear or conditional scenarios using the Scenario tab. Wirelessly transfer X-ray images, videos, and audio files to the Guimard monitor's vital signs screen. Use the streaming voice feature to be the voice of the simulator, such as when taking patient history, and listen to the care provider's response. At the end of simulation, use the evaluation feature to collect care provider performance and feedback information. The simulation experience can be enhanced with the use of the Pro Plus Recording and Debriefing System, which combines the Guimard Ui simulator control interface and a recording solution together in one PC. The system includes two pelvic cameras, a head-mounted camera, and an overhead camera, which allows the user to record the procedure so that the instructor can review the surgical technique at his or her convenience. The multi-camera system allows the reviewer to select the view which is most useful for the evaluation. Mounted within Chloe's torso are two infrared cameras which allow close assessment of the operative technique, such as knot integrity and dissection abilities, even in low light conditions. The head-mounted camera provides an eyes of the surgeon view, which permits the reviewer to see the operative field as it was seen by the primary surgeon during critical decision-making events. The overhead camera provides a global view of the room so that team function can be assessed. The Pro Plus interface is divided into two screen modes, the Guimard Ui Simulator Control Mode and the Recording and Playback Mode. Switch to the recording screen to manage the session's recording, camera views, and track log events. The Pro Plus web interface allows instructors or audience members to playback session footage remotely using a web browser.
The learning package for Surgical Chloe includes preloaded software. Part of the software includes a surgical checklist. With a surgical checklist, an instructor can check off the accomplishments of the learners as the learner proceeds through the surgical procedure. An example of the surgical checklist is the suction curettage of the uterus checklist. But the software also includes much more intense educational opportunities, such as full scenarios, which will evaluate an entire team. An example of that scenario would be the malignant hyperthermia scenario. Medical education today is designed to ensure that learners demonstrate their competencies in specific areas. These competencies include medical knowledge, patient care, systems-based practice, practice-based learning and improvement, communication, and professionalism. The scenarios can be used to assess any of these competencies. For example, the malignant hyperthermia scenario can be used to assess the competency of communication It can also be used to assess the competency of systems-based practice, because a whole team has to work together. They have to communicate together, they have to work together as a part of a system. This next section will demonstrate the ruptured ectopic scenario. If that scenario were being run the same fashion that it's run in the Chloe workbook, the participants would already have seen the patient in the emergency room. They would have made a diagnosis of ectopic pregnancy. They would have noted Chloe's hemodynamic instability. They would have quickly have moved her to the operating room. She would have then, of course, been assessed by the anesthesia team, intubated, and now be ready for surgery. This demonstration will be done with uterine assembly number 2. That is the assembly that has an enlarged uterus, an ectopic pregnancy, and an immature teratoma. We're going to do a laparotomy on this simulated unstable patient. Let's take it that way. And another one this way. Thank you. And now we'll stretch that out a little bit more, Javier. And you can see a little bit of the simulated blood there. Now we're cutting the fascia. And we're going to take our incision laterally. Okay, thank you. We're going to add Coker clamps now and demonstrate a fan and steel incision. All right, Javier, will you take those? You can drop that. Take those. You can put that one here. And with Mayo scissors. Put up like that, please. Thank you. All right, let's move down. I'll take that. Would you move this retractor up here? Thank you. You can see the underlying peritoneum. Let's put this retractor in here, on here. Let's put that retractor on the other side. We'll carefully incise the peritoneum. All right, you can take that out. You can take these off. Just like a real patient, we're going to stretch this now. All right. Now we will place our self-retaining retractor. One of the things I've noticed when residents do this case is that many of our younger residents have never placed a self-retaining retractor because they do so much laparoscopic work. And that kind of demonstrates the value of surgical Chloe. When residents do a laparotomy today, it's a very difficult case. So they need some easy cases.